My name is Kristen McAllister. My friends call me K-Mac. I am 18 years old, a senior in high school, and I live in Knoxville, Tennessee. I have polyarticular juvenile idiopathic arthritis. Prior to receiving that diagnosis at the age of 13, I saw 8 different doctors, experienced 3 years of medical testing, and endured 3 joint surgeries. Even then, my disease went undertreated for the next 5 years, which contributed to the development of numerous joint contractures. We don't have a pediatric rheumatologist in East Tennessee where I live. My adult doctors at the time really cared for me and did the best they could. But my journey would have been entirely different if I had access to a pediatric rheumatologist from the very beginning. This past summer, we discovered the Pediatric Rheumatology Clinic at Children's of Alabama. Now I travel to Birmingham for my monthly infusion treatment and every other month to see Dr. Lowe at the clinic. He's my hero. This trip takes us about 4.5 hours each way and requires an overnight stay at a hotel. Before 2007, there was not even a clinic in Birmingham.
Alabama does not have, at this time, a board-certified pediatric rheumatologist practicing anywhere in the state. Making the diagnosis of these patients early on in the treatment, aggressive treatment with anti-inflammatory medications and physical therapy is really the way to prevent chronic joint deformations and eventual permanent disability.
One of the real deficiencies that we had was, for 5 years, we had no pediatric rheumatologist, none. It was a glaring hole in our effort to be a full-service children's pediatric center.
The children with arthritis were being cared for in large part by a combination of adult rheumatologists from UAB who were kind enough to come down and help out, as well as a pediatric immunologist who, out of his heart, Dr. Scott Atkinson, was taking care of these kids, but without really any formal training in rheumatology.
It became evident to me as time went on that we were falling short of providing adequate care for children with these diseases.
My name is Yashika Clinton. My daughter is Kimberly Clinton. She's 13 and she's had juvenile arthritis since she was 2. Back in 2005, Kimberly was at a level 3, and at level 3 what that means is below what a doctor wants a child to be at in this kind of condition. That means they're not up to par as far as walking and running and just being independent. Be still.
Be a little still.
Be still, Kim.
1, 2, 3, stick.
I actually thought that I would just have to take care of her myself for the rest of her life. As a parent, you want to grab your child and just take all the pain away. And in certain conditions like that, it's nothing you can do. You're hopeless.
I reached a certain level of desperation and decided that the only people that could really help me would be the Arthritis Foundation outside the university. This was a need that was urgent, that was not being met, and that children were becoming gravely debilitated, if not actually dying.
The only way Children's of Alabama could attract pediatric rheumatologists was to form a partnership. We couldn't do it by ourselves. So we formed a partnership with the Arthritis Foundation and the University of Alabama School of Medicine. So among the 3 of us, we had the combined capacity to put together not only a package that was attractive from a financial standpoint, but a package that was substantial from a support standpoint.
When the clinic first opened, we had a huge waiting list of kids to see. We were full of a lot of pent-up demand for kids who needed to see rheumatologists for many, many years. And really for the first 4 years or so of us being here, we saw kids who were very sick.
Today, we have not 1, not 2, but 5 pediatric rheumatologists here at Children's of Alabama, and they serve literally thousands of children from this surrounding area.
Potentially, we could certainly add more clinical help, and we're trying to do that in part through a fellowship training program. So we're starting to train fellows who will hopefully stay in the Southeast, if not in Alabama itself.
That's why it's so important that we build partnerships in the future that can help make that future brighter for kids all over Alabama, and if this training program is successful, kids all over the United States.
The research efforts that we made have gotten attention of our colleagues, both nationally and internationally.
My disease is finally being treated aggressively by a physician who is aware of current findings and the latest research for treating JA.
I'm thankful for UAB, Children's, and all the doctors that came together. They just make our heart feel much lighter.
I walk into clinic smiling every day because it really makes me very proud to have been a part of this effort, and of all the things that I've done in my life, I think it's the thing I think that I'm the proudest of.
The Arthritis Foundation's former Alabama chapter took the lead in this partnership, and the Southeast region has now completed that commitment. Over $1 million was raised to endow a chair in pediatric rheumatology. By working together with the UAB Hospital and Children's of Alabama, they did what none of the organizations could have done alone. In fact, everyone involved calls it a unique partnership resulting from inventive thinking and determined leadership. So think outside the box. Maybe there are new ways to fulfill the mission of the Arthritis Foundation that will benefit the people of your community.